Well, good morning and welcome to the NCRO Aging Information Subcommittee's webinar on helping older adults and family caregivers. This is Dale Cook, and I'm an NCRO board member and member of the Aging Subcommittee. I'll be your moderator for today. We have a very special guest with us, Jenny Jarvice, who is with the Area Agency on Aging 1B here in the Detroit area, but her plan is to talk about what the agency does throughout the country. And Jenny has been with the agency since 2001 and oversees a number of areas, including marketing communication, the information assistance, long-term care ombudsman program, the Medicare Medicaid assistance program, which is for its planning and advocacy, the agency's provider network, along with community health and aging services, social, caregiver, nutritional services, transportation options, health and wellness workshops. Jenny is also in charge of the agency's strategic planning. She holds a Bachelor of Kinesiology from York University and an MBA from Schulisch School of Business. You always got to be a challenge on pronunciation for me. Turn this all over to Jenny, who is going to entertain you and educate you over the next 30 minutes or so.
So what we're going to cover today is what is an area agency on aging, services that we provide to help seniors remain living at home, and services as well that are provided through the area agencies on aging to support family, friends, neighbors, and we bucket those individuals essentially as family caregivers who are helping a senior. So what is an area agency on aging? It's quite a name. Area agencies on aging were created in 1965 by the authorization of the Older Americans Act. That was a piece of legislation that passed Congress, essentially designating an organization that would provide services in a regional part of the country. It's a national network. As we've talked about, it connects seniors and family caregivers with local services to improve quality of life. There is one area agency on aging per designated geographic area in the continental states, as well as Alaska and Hawaii. So essentially, there's over 600 area agencies nationally. Most of the programs that we provide are for people 60 years of age and older. That is part of the piece of legislation, the Older Americans Act, that passed in 1965, designated that the group of individuals who would be served through this funding are, again, seniors within 60 and over. So that's why when we talk through some of these programs, you'll see that age come up frequently. Area agencies on aging are an unbiased, trusted source of information. We're not trying to sell products. We simply try to provide information and guidance to individuals who contact us. Area agencies on aging can be structured differently. Many are structured as nonprofits, such as Area Agency on Aging 1B. Some may be part of local government. One of the things to understand is not everyone uses Area Agency on Aging in their organizational name. So we're not like a American Diabetes Association where everyone has the same name and the same brand. So area agencies on aging can be called something different depending on the community where you live or your older loved one resides. A little bit about the Area Agency on Aging 1B. We serve 6 counties in Southeast Michigan: Livingston, Macomb, Monroe, Oakland, St. Clair, and Washtenaw. And there are 2 other area agencies on aging that serve Wayne County in Southeast Michigan. On this slide, you'll see the contact information for 1B. I'm also going to share the contact information for the 2 area agencies that serve Wayne County as well. Then we'll talk about how do you find your area agency on aging if you or your loved one lives outside of Southeast Michigan. We know we have people on the webinar that are outside of this service area. If you have a pen and paper, I'd recommend you jot down the phone number and the website, because I'll be referring back quite frequently to contacting a local area agency on aging to learn more about some of these programs and services. I'm just giving everyone 1 second or 2 to write down the phone number, 800-852-7655. 888-7795, or again, the website AAA-1B.org. For Wayne County, if you've joined us from Wayne County, there are 2 area agencies: Detroit Area Agency on Aging, which goes by 1A, serves the city of Detroit, Hamtramck, Highland Park, Grosse Pointe area, and Hartford Woods. Their phone number is 313-446-4444. And the Senior Alliance essentially serves the rest of Wayne County, and their phone number is 800-815-1112. And their website is also up on the screen. I'll just pause for a few seconds in case people want to write down that contact information. Okay, and then what if you reside outside of Southeast Michigan? It might be another part of Michigan. It could be in Arizona. It could be in California. So there is a national website called eldercarelocator.org, or there is a toll-free number you can call, the 800-677-1116 number. That website or that phone number will essentially refer you to the local area agency on aging. If you were to go to the website, you would put in the zip code or the city and county of the area where the senior who needs support resides. Because the majority of our programs are directly for the senior, you would want to find the location, the area agency for the region where the senior resides. This service is a public service of the U.S. Administration on Aging, so it's a very safe service. It provides some different information as well if you were to visit that website that you might find helpful and interesting. So we'll talk about some general programs and services for older adults that are provided through area agencies on aging. The first one is information and assistance. This is a free telephone service that offers resource options for older adults or families and caregivers. Anyone can call the local area agency on aging to get information and assistance. If you're a neighbor and you might want to find out a bit about some services for your neighbor who lives next door to you who's an older adult, you can call and get some information and then share it with that senior if they're interested. There's no restrictions on who can call and learn more about services that we provide. The staff who answer the phone can talk about some of the programs we'll talk about specifically today, and they can also connect you to many programs and services that are available in the community that are provided by other organizations to support seniors and family caregivers. We can email or mail that information on the services discussed, or we can simply provide phone numbers over the phone. It's whatever works best for you as the caller and how you'd like to receive your information. Area agencies on aging are really the first place to call when you or your loved one starts to need help to remain living at home. All area agencies on aging offer this specific service. And again, refer to earlier slides for how to contact your local area agency on aging. Some of the services that we get calls about, we get a lot of calls about assisted living and housing. In our region, we have over 5,000 different programs and services in our database that are provided directly through other community organizations that we can provide information and link seniors and family caregivers to. So most area agencies maintain a very robust list of services and programs, including housing options for seniors. That can be independent senior living, assisted living, through to licensed facilities. We can talk about case management, congregate and home delivered meals, housekeeping assistance, legal services for seniors, personal emergency response systems, Medicare options, personal care, respite care, which is a break for caregivers, transportation options, senior centers, community activities, support groups, utility assistance, and it goes on, but this gives you a flavor of some of the types of calls that we receive and some of the information and we can provide on various services, either directly through us or again, through other organizations in the community. I'm going to talk briefly about in-home care programs. There are government-funded programs for eligible older adults that can bring care into the home and help cover the cost of that care. This one is specific to Area Agency on Aging, but I'll talk about in general across the country how this would also be available. In Michigan, we have a My Choice Medicaid waiver program, And through our agency, we provide the community living program. I do have slides that'll talk in more details to these programs, but again, your local area agency on aging is where you'd want to call to get more information on the in-home care programs in that area. For the My Choice Medicaid waiver, this is essentially where Medicaid will pay for services in someone's home. It can be the home of the senior. It's also available for adults with disabilities. It can be in the family caregiver home. It can be in an independent senior apartment. It can also work with assisted living and participating licensed residential facilities, such as homes for the aged and adult foster care homes. It can provide services to help support family caregivers. It's again available to seniors 65 and older and adults with disabilities. There are two eligibility criteria. One is a care criteria. The individual who needs support must need a nursing home level of care. And there's a financial eligibility, and this is the financial eligibility in Michigan, which is just about $2,700 in monthly income or $2,000 or less in assets. And again, when you call your local area agency to get more information, they'll help explain the nursing home level of care, the financial eligibility. This just gives you an idea of what the qualifying criteria are. Most states have a similar program to what we call the My Choice Medicaid waiver. For example, in Ohio, it's the Ohio Passport Program. So again, even though I'm talking about a very specific Michigan program, there are Medicaid waivers available across the country. A few examples of services an individual may receive if they are enrolled into the My Choice program or into a waiver program. It's really based on what their care needs are. So it can cover anything from personal care, homemaking, caregiver respite, again, which are breaks for caregivers, adult day service. We'll talk a little bit about what that is coming up, meal preparation, personal emergency response. I won't read through all of this, but you can see it can cover quite a lot of services to, again, help that individual remain living in the community instead of going into a nursing home on Medicaid. The community living services, that's the name we give in our region for these services, these in-home care services. This is funded through that Older Americans Act, so it is for seniors 60 and over, and also for family caregivers that provide care and support to somebody 60 and over. Services may include homemaking, personal care, again, a personal emergency response system, which is essentially, if I didn't explain it before, that lifeline for buttons for seniors at risk of falls. Again, it can help support family caregivers through that in-home respite, adult day, which is where the older loved one can go to a community facility. And again, we'll talk a bit more about that. Other area agencies may refer to this program as care management, case coordination, and support. All area agencies across the country receive funding to provide this type of program to seniors residing in their region. The one thing to be aware of is because it is federally funded, programs may have wait lists. And then when there's wait lists, area agencies are required to serve those with the highest economic and social needs first. So there may be some prioritization on who is receiving services if there are wait lists in a specific area. So we've talked about the Medicaid program, and I've talked about, a program for, again, seniors who might have a higher socioeconomic needs. So we understand that not all seniors are going to be eligible for government-funded in-home care programs. But what the area agencies on aging can do for those families or seniors is help you navigate and understand what your long-term care options could be. That can include private pay, veteran services. We can help understand or help provide information to help a veteran or maybe a surviving spouse understand what services they could be eligible for, and then refer them to their appropriate Veterans Administration to follow through on applying for that coverage. And there can as well be other community options that aren't as limited by eligibility criteria that may also be able to help. For example, some counties in Michigan have millage programs, and those millage programs have less restrictions and quite often more capacity to provide some in-home support for seniors. What we all know is navigating long-term care can be very complicated and area agencies on aging are here to help you navigate and understand what your options are. Everyone's familiar with the Meals on Wheels program. Area agencies on aging receive funding to help fund those programs. Many programs also receive funding from other partners and other organizations in the community. And we all know this program provides typically a hot lunch most days of the week. It's that friendly face at the door. It's also someone that checks in on a homebound senior, especially somebody living alone. There's often been situations where that volunteer delivering the meal, if somebody doesn't answer their door, there is a emergency process that's set up where the caregiver's contacted, EMS could be contacted. You know, we want to make sure that senior's safe. So it's more than just that meal. It is really a check-in on that homebound senior. A lot of people think Meals on Wheels is a income-based program, but there is no financial eligibility for Meals on Wheels. Essentially, a person needs to be 60 and over, homebound, or essentially unable to leave home without assistance. So they might be able to get out periodically to church with assistance or go somewhere, someone picks them up, drives them, helps them navigate, so they don't have to be homebound to the point where they're unable to leave their home. And again, this is a national program available across the United States that's supported through your local area agency on aging, and that would be the organization you call to find out more about that particular program in your region or where your loved one resides. There's also a congregate meal program, not a very exciting name, congregate meals. It's really more of a social meal program. This program provides a healthy lunch and usually comes with some type of educational program. They're often held at senior centers, housing facilities, churches. The eligibility for that is really anyone 60 and over who wants to go out and enjoy a healthy meal, have some social engagement. It's really focused on trying to minimize social isolation in seniors, often maybe for seniors who have lost a spouse. They might not be cooking as well for themselves. This provides an alternative where they can go, whether it be 1 day a week, 2 days a week, a few days a week. There is a voluntary donation that's requested for that program. And again, this is a program you can learn more about through your local senior center. Help with understanding Medicare. Medicare can be very complicated, especially if you're newer to Medicare, you're transitioning into it, or it's during open enrollment, and some of you listening may be starting to look at what your options are during open enrollment. In Michigan, the program is called MAP, or the Michigan Medicare Assistance Program. It provides free and unbiased help with Medicare and Medicaid if somebody has Medicare and Medicaid, essentially what we call dual eligibles. Some of what the trained and certified volunteers can help with is free counseling during open enrollment to help you understand what your choices are and your options are for 2024. They can go over cost saving programs. There might be lower income seniors that you know who are struggling to pay for medications or struggling to pay for, you know, other groceries, et cetera. There might be Medicare programs that they can apply for to help reduce their Medicare costs, which gives them more money to pay for groceries and other needs. If you feel you've been a victim of a scam or wonder more about maybe a fraud that's going on, Medicare fraud going in your local area, the MAP program can help. This program is available across the United States. It's called SHIP, State Health Insurance Assistance Program nationally. If you look at your Medicare and U-Book, you'll see us in your Medicare and U-Book. You'll see the SHIP program. And different states have different names for what their SHIP program. So again, the reference it in your Medicare and U, MAP, the MAP number is on the screen for Michigan. And again, if you live elsewhere, call your area agency on aging. If they don't directly provide the program, they can let you know the phone number to call for who does in your region. My Ride Too, this program is very specific to Southeast Michigan. I'll talk very briefly about it. So for those that reside in Oakland, Wayne, Washtenaw, Macomb County, we do provide this program. It can help people understand mobility options. So it may be a senior who's given up their car keys and they're looking to understand what different transportation options are available in their area. We can help to arrange rides for seniors who are unable to do that themselves. Reference about how we can help plan for driving retirement. We also offer what we call how to use a smart bus. So we provide classes where we actually go out and show people how to navigate and use public transportation. The one thing to know is that all area agencies across the country, through our information and assistance program that we talked about earlier, can help provide information at least on transportation options that are available in the local community. And that could be anywhere from senior center transportation, SMART, through to wheelchair accessible, door-to-door support that certain seniors might need who are unable to use public transportation, need someone to escort them out of their home and into the appointment. So there are different levels of transportation. Unfortunately, there's not enough money to help for area agencies to help people pay for the transportation, but we can help people get connected to affordable options. Area agencies on aging across the country also receive funding to provide evidence-based health and wellness classes for seniors 60 and over. These are often offered both virtually and in person. These programs are smaller groups of 8 to 10 students. Classes run 6 to 10 weeks depending on the class. These are free classes that are available through area agencies on aging. To give you a flavor of what we provide in our region, we provide Aging Mastery, which is a one-day class focused on retirees looking to make the most of their retirement. We have a 6-week Matter of Balance class, which is 2 hours every week that really helps people do fall prevention, work on core stabilization exercise, and also learn how to fall properly if you do fall. We have a diabetes path, which is for people with type 2 diabetes, a chronic pain path class, which helps individuals learn to cope and manage chronic pain. And we recently introduced a virtual class only that's called Eat Smart, Move More, designed at helping people be more healthy and active in their retirement. And again, this is funding nationally that area agencies on aging receive, but we all use it to fund different programs depending on the needs in our communities. So again, an opportunity to contact your local area agency to find out more about these programs. In our particular service area, we have Connect. This is an information and resource guide. We do have articles on long-term care, caregiving, aging that could be relevant for people outside of our region. For people who live in one of our 6 counties, you can see it on the bottom of the screen. Again, at the bottom of the photo here on the slide, the 6 counties we serve, we have resource listings for those counties. You can download this on our website, or you can call 800-852-7795, which is a toll-free number for Area Agency on Aging 1B, and we can mail you out a copy. And again, you don't need to live in our service area to receive a copy of Connect or visit our website and download it. I'm going to talk briefly about programs and services for family members who are providing care to an older loved one. So we have workshops, just like we have evidence-based workshops for seniors, we have evidence-based workshops for caregivers. The one we provide through our region is Powerful Tools for Caregivers. Other area agencies may provide a different version of this type of workshop, but many of them do provide workshops for caregivers. Again, these tend to be 6 week to 8 week workshops. Again, the classes are small, they're offered virtually or in person. And if you're interested in learning more about what might be available in your region, you can contact your local area agency on aging to learn more about these caregiver workshops. And again, these workshops are available free of charge for family members who are caring for an older loved one. We talked a bit about adult health services. You heard me reference it a few times about being a service that some of our government-funded programs can help provide. But this is a program that's available for any family caregiver in the community. And they are socialization, supervision, and activities at a day center, typically for seniors or even adults with disabilities with dementia. So adult day health services tend to support more individuals with dementia. It allows caregivers to work or take time for themselves during the day. So I don't like to It's not the same as childcare. It's very different than childcare, but it works similar to childcare, where an older loved one could go full-time, 5 days a week, or they may go part-time, a few hours a day, a few days a week, and it helps give that family caregiver a break. Some of it can include, some of the facilities can provide personal care at an additional cost. They will provide meals while your loved one is there. And many of the facilities also have transportation where they'll pick up someone and drop them back off. There is a weekly or daily cost to attend, but is usually about $70 to $100 a day, depending on the level of care services that the older person needs or that the family caregiver would like that facility to provide. But it's it's an underutilized option in the community, one that a lot of family caregivers aren't aware of. Another service that's provided nationally by through area agencies on aging is a program called the Long-Term Care Ombudsman. This is a program that works on resolving and mediating disputes for residents living in long-term care facilities, mainly in nursing homes. So it's a statewide program that can help you understand as a family caregiver, or help a resident in a nursing home understand their rights, make sure they're receiving the correct services, if there's quality of care concerns, etc. The long-term care ombudsman can become engaged and provide support and guidance, working with that local nursing home to address some of these concerns. Again, it's a national program, and you would find out how to contact your local long-term care ombudsman through your local area agency on aging. Lastly, this is a program, again, that we provide. I won't spend a lot of time on. This is very specific to Area Agency on Aging 1B. It's our caregiver coaching program, and we have volunteer caregivers who are here to work with other family caregivers and provide that support one-on-one. They can be a listening ear. They can help find resources. They can be someone to talk to help sort through hard decisions. You can connect with them by phone, email, or video. You can meet as often as you want or as little as you want as a caregiver. Again, currently it's only available through our Area Agency on Aging 1B. But if you're listening and you're from our region and that might appeal to you, whether you want to be a volunteer or you want to be matched with a coach, you can call our phone number or visit our website for more information. Lastly, we often get calls about hiring private caregivers. So what the Area Agencies on Aging, we provide services, we provide information on home care agencies. We don't have options to link you to what we might call a private caregiver, somebody that you hire directly and pay to provide care for an older loved one. There are two websites or two online companies that can do that. One is CareLinks. It is a professional caregiver marketplace. They connect trusted and licensed caregivers, to families or seniors in need of home care services. This particular organization does background checks, etc. So you can visit carelinks.com for more information, to search for a caregiver, learn more about that as an option. If you're looking at trying to hire someone privately, care.com also does this, but they do not employ the caregiver. They're not responsible for the conduct of any user on their site. It's really an opportunity where caregivers who want to work with the senior population can put up their information, but you need to do your own diligence and background checks, hiring, etc. But it is another resource to maybe find a local individual who wants to work and provide care for a senior in their home. A few things to think about: if you hire a personal caregiver that's not associated with an agency like a home care agency, be sure to do a background check, a criminal background check, get personal references, develop a job description that outlines responsibilities and expectations. And Area Agencies on Aging can give you a bit more information about things to think about if you are going to be hiring a personal caregiver, but we don't have resources in our database to link you or give you names of personal caregivers in your community. So that really ends my presentation. So I'm going to stop sharing my screen and start to take questions.
So here's the first question, and feel free again, in the questions box, if you have any questions for Jenny, just type them in and send them to me. Or if necessary, you can certainly email them and we'll answer them later. But we'll get started with those that I've received before the session started.
So in response to this question, I did talk about the long-term care ombudsman program. So, that would be an opportunity to work with the long-term care ombudsman. They cannot help with placement, but they are a good source of information on what nursing homes might have better quality and better staffing if you're looking to move a loved one from one nursing home to another. A lot of nursing homes are short-staffed. That is something we've just seen, whether it be nursing homes, home healthcare agencies. There's a shortage of direct care workers nationally to work in nursing homes, to work with home care agencies that provide services in seniors' homes. There's just a shortage, unfortunately, of staff. So we do see a lot of nursing homes are dealing with being short-staffed. There's definitely policies happening at both the federal and state level to try and address this. It's a definite need that's been identified. Again, it's just trying to, find individuals, find the funding to help pay individuals at a higher rate to retain them to meet this need. So the long-term care ombudsman, though, would be one option to contact, whether it be quality issues in a current nursing home where the individual resides, or again, maybe a little bit of inside scoop on the few nursing homes in the area that you might be considering moving someone to. Finding a local caregiver in East Lansing while a family member is retired and living in Florida. So again, there's a few options. If you're looking to work and hire a home care agency, that would then go in and provide that care for this individual, you can contact your local area agency on aging and they can provide referrals for you to some local home care agencies that can do that. If you're looking at hiring someone directly, I did put up the care links and the care.com as two options. Otherwise, it's very challenging when you're living elsewhere and you're out of state. So those are the options that I was able to think of for that particular service. This is an interesting question. So there's limited in-home care agencies. Yes, sometimes there's definitely limitations depending on the geographic region. More rural communities are harder to serve through private pay agencies. Can a housekeeper be trained? That's really up to you as a family caregiver. There's not direct training that's provided through area agencies on aging for someone to become skilled at doing direct care. It really would depend on what the level of care needs are for the individual that this person would be caring for. There are platforms like TruAlta has a platform that might be something that's available through the area agency on aging that serves Sheboygan. I know a lot of area agencies are starting to provide access to TruAlta for no cost, and it's an online platform where people can watch videos, learn more about in-home care. So that might be an option to contact your local area agency about. And again, different area agencies have different needs. So this might be something that you can ask the area agency about. You may have already tried that. If you have, unfortunately, I don't have a lot of answers for this specific question.
Hey, Dale.
Yes, go ahead. I was just typing in your question, Casey. But
Okay,
go ahead, ask it live.
No, okay. Hi, Jenny. I have a question. At one time, a few months ago, there was a program called Caregiver Respite Vouchers of $575, and caregivers could apply to get, respite help. Is it still going on? And if it is, can you explain about it?
Yes, Casey has talked about a program that's only available through Area Agency on Aging 1B. So this is very specific to our 6-county region that we serve. Again, that's Livingston, Macomb, Monroe, Oakland, St. Clair, and Washtenaw. This is a grant-funded program where we have an opportunity for family caregivers to apply to receive $575 to help them pay a private caregiver. It could be a family member, it could be a neighbor, it could be a home care agency that you hire, but it gives that family caregiver $575 that they can use over an extended period of time to help cover the costs of in-home care services, primarily respite care services, so unskilled care in the home. If someone's listening and they're interested in learning more about that program, again, they can call the 800-852-7795 phone number or visit our website at AAA-1B.org. But yes, we currently have that program through to September of next year.
I have a question that's the website eldercarelocator.org. It doesn't appear that's a live website. Did it may be typed wrong?
It might be .org. Oh my goodness. Let me just check.
He did try .org.
It's eldercare. They changed it. eldercare.acl.gov.
Okay, I'll back up here. I've got a question. Can you see the question?
Oh yeah, sorry.
Oh, it's okay.
When a senior requires care, there is a sudden need for money to pay. How can families best prepare for such an event? Yes, senior, you know, when somebody starts to need help to remain living in their home, there definitely is a cost to it. Whether they're going into a nursing home, a lot of families do not plan, a lot of individuals do not plan for their long-term care needs. I mean, there's two ways to look at it. You can start planning now for your long-term care needs. If you're younger, if you're in this situation where there's suddenly a need for money to pay, this becomes a challenge. We see families or seniors that run out of money. They run out of money and they can't afford to pay for their assisted living. They run out of funds and have to go onto Medicaid in a nursing home, which can change what nursing home bed they're in or what nursing home they're, at what facility they're at. There aren't programs out there that if they're not eligible for government funded programs, there's definitely a gap. There is not a lot of options. I would suggest, again, if someone is starting to spend down assets or there isn't sufficient funds, that's when you contact your area agency on aging just to understand what programs are available. They might not be financially eligible for them or have the level of care need now, but it's something that would be helpful for that long-term care planning. And what area agencies on aging can do is provide options counseling. They can help family members or seniors just understand what options there could be for long-term care. Look at those government-funded options. Maybe millage programs in your region that can help pay for services or provide services. The easiest way to plan is to start planning really early for your long-term care needs. And it's definitely often a crisis when this happens. It's unexpected. It could be a stroke, it could be a heart attack, it could be a bad fall, and overnight the needs of your older loved one change significantly. So again, I think understanding what your options are through the area agency on aging is your best first step.
Well, that looks like the questions. We've got them covered. We can give them a minute or so to, since I'm calling it an end. This was the other question. I got it placed on it, so we got a flag. What was the name of that website? I'll just put it on here.
Yes, do eldercare.acl.gov.
Okay.
And I apologize for that.
Oh.
It's been elder care locator for so long, and I missed that change.
We've got good to know that we've got folks that are tech savvy to check the websites. And that stall didn't add any more questions. So based on that, Jenny, thank you so much for your time today. Some really good information for our members. And we do appreciate you taking the time out of your busy day to come talk to us.
Right, Ed. Thank you for the opportunity. And again, don't hesitate to call your local area agency on aging for more guidance and information.
All right. And at this point, we'll be closing the webinar. Everyone have a very safe and pleasant day. And above all, have a great Thanksgiving. And this is our last webinar for the year. So also have good and happy holidays. Let's all stay safe and be here next year. Have a wonderful